Well, listen, you've humored me. You let me go on with my questions. What do you want to say about the issues most important to you and about your candidacy? I appreciate that you've borne with me for 4 of mine.
Well, I just right now I've formed Our America Initiative, trying to put a voice to the what I think is the outrage that Americans are feeling, and that outrage is the fact that the United States of America is bankrupt. That 43 cents out of every dollar we're spending is borrowed, that we need to slash spending, that taxes need to be reduced. But in fact, spending is increasing significantly and taxes are going up across the board. I would argue that that when you look at cost-benefit, that we should be slashing spending when it comes to Medicaid, Medicare. We should be reforming Social Security so that it's viable into the future. Just looking simply at government spending should be cut 43% just to get revenues and expenditures in line. Looking at some of the issues of the day, I believe in free markets when it comes to education, bringing competition to public education. I believe in free markets when it comes to health care, which is an industry as about removed as it possibly can be from the free market. I don't believe that we should be in Iraq or Afghanistan and that we should reassess everything that we're doing militarily worldwide. I believe that we should bring an end to the war on drugs. I believe we should legalize marijuana. I think that 90% of the drug problem is prohibition related, not use related, and that's not to discount the problems with use and abuse, but let's stop arresting 1.8 million people a year in this country. Let's stop spending half of what we... Let's stop with spending half of everything that we're spending on law enforcement, the courts, and the prisons. I think that it's crazy. When I say legalize marijuana, it's never going to be legal to smoke pot, become impaired, get behind the wheel of a car. It's never going to be legal for kids to smoke pot. When you look at immigration, I think that the immigration issue that we're looking at right now can have 75% of the problem can be addressed if you just make it easy for immigrants to get a work visa and legalize marijuana. 75% of the border violence is marijuana related. Drug cartels from Mexico playing out disputes with guns rather than the courts.
You did remind me of 2 other questions of mine, quick ones. Do you mind?
No.
Okay. Regarding taxation and regarding repealing the so-called Bush tax cuts now, which were scheduled to be repealed, and which now some people are calling a tax hike to not repeal the tax cuts. You know, I assume that back in the good old days, the prosperous days, the Eisenhower days, the top tax bracket paid 93%. Okay, so maybe not 93%, but do you see anything wrong with the people who make the most money in this country paying proportionately more their share in taxes?
Yeah, I do.
Oh,
I do.
okay.
I do. I think that I think that whatever you tax more of, you get less of. And so if you want to tax the high income earners, they're just going to bow out of creating jobs. They're going to bow out of being as productive as they possibly can. And that productive as you possibly can be results in increased demand on goods and services, which stimulate or motivate or require businesses to hire more people to meet that demand.
So you really believe, from your observation and from experience, that the most people with the most money are actually doing some hiring or producing something worthwhile?
Or consuming, and as a result of consuming, creating jobs.
Okay.
So all the above, yeah, all the above.
Okay, fair enough. One final question. A guy I know recently went into the hospital for 6 hours for an outpatient procedure, a double hernia repair. 6 hours in and out, $50,000. Any thoughts?
It's healthcare system is as far removed from the free market system as any industry in the country.
I believe, within the free market, what you would call the free market system.
I wouldn't, because there's no advertised pricing. He didn't know what he was going into. He didn't know what he was going to end up paying. do you believe that $50,000 is going to get paid unless he's uninsured? If he's uninsured, then he is going to be on the hook for that $50,000. But if he's insured, his insurance company isn't going to pay that. And why we're paying insurance in the first place, as opposed to having advertised pricing where there would be a hernia hospital in Albuquerque or a hernia clinic that would offer that same surgery at a cost of several thousands of dollars as opposed to $50,000. I had envisioned healthcare reform as having Gallbladders Are Us, offering gallbladder surgery at thousands of dollars as opposed to tens of thousands. We're getting on airplanes right now to go to India to have heart surgery at tens of thousands of dollars rather than hundreds of thousands of dollars. So there's no advertised pricing. It is...
Well, what's keeping anybody from doing advertised pricing and competitive heart surgeries for a tenth of the cost here? What is it that's keeping that from happening?
Well, you've got insurance. We've gotten into this insurance model as opposed to pay as you go. I think I would buy catastrophic insurance for myself. But by the way, once the new healthcare system takes effect, we are all going to do an analysis of whether or not we should not pay insurance anymore, because if we contract a catastrophic injury or illness, we could sign up and be guaranteed coverage when that happens. Analogous to being able to buy fire insurance on your home as it's burning. Why would you have fire insurance on your home if you could bind coverage as it was burning? So I would order up a really good smoke detector so that as it was burning I could bind that coverage.
Well, I don't know. There may be regulations that prevent that, but I couldn't speak to them.
By regulations, again, it
know.
is the most regulated of all industries.
No, I'm saying within the new legislation. I suspect there are limits, but okay, I'll take your word for it because I don't know any different.
Well, actually, I don't either. I mean, the details of this keep trickling out, but I will say that in Massachusetts, where this is the model that's in place, citizens of Massachusetts are gaming the system. They're paying the penalty, they're paying as they go, and then when they find themselves with a catastrophic illness or injury, they're going in, signing up, getting the insurance immediately. That's covering their illness, injury, and then they're going back off of it once their injury, illnesses has been paid for and taken care of.
Well, and so the people who do not have the $5,000 or $10,000 for the competitive heart or gallbladder surgery, what happens to them? I know I get catastrophic insurance, which I can afford more or less. That's my answer to it. But do you think that should be the general answer?
Well, there's a combination, a whole bunch of combinations. Medical savings accounts that would be tax deductible. Putting that money into your own bank account and being able to dole that out, and of course, doling that out, combination of pay as you go and a catastrophic insurance policy. Advertised pricing. When it comes to elective surgeries have gone down significantly when they're advertised, as opposed to, and you see it. But when it comes to stitches, I got some stitches in Taos this last winter on my forehead. 5 stitches, $600. Holy cow! I'd have driven down to Albuquerque to get those stitches for $60, $75. I'd have just put a Band-Aid over them and driven down there for $60, $70 because it didn't take but about 8 minutes to administer. And I'm not saying it would have been 60, 70, but I'll bet anything that in a competitive environment, a truly competitive environment, that would have been significantly less. And truly competitive environment would be blowing the lid off of medical supply, allowing healthcare entrepreneurs that want to deliver a better product, a better service at a lower price, the opportunity to do that. But it's such a regulated environment that individuals can't get in there and do that. All in the name of health and safety.
Okay. Well, I'm not sure I know that the high inflated prices come from insurance and regulation, but maybe you know better, or maybe we'll agree to disagree about that.
Well, it comes from the inability of certain people not to pay, and the fact that 40% of every dollar that a doctor bills is not collected. Why wouldn't they simply reduce their prices 40% if everything that came in the door was cash? And then you've got the insurance companies that are running the entire system as opposed to the doctors themselves. And we've just made it worse. We've just made this whole thing worse with the recent legislation that's passed.
Okay. Well, let me close with a story that has nothing to do with anything, but just to tell you one of the reasons I appreciate you. Is that okay? I don't know if you would remember this, but this is just to me an example of how unassuming you are, which is what I appreciate about you. One of the things I appreciate about you. But I bet you don't remember one time I ran into you at the Taos Film Festival where I was involved somehow or other. And I looked outside and there you were standing in line. It was cold. You were standing in line with everybody to get into a movie. And I recognized you and I went out and said, well, Governor, why don't you come in? I'm sure you can get to the head of the line. I mean, come on in. And you said, well, I don't think I should get to the head of the line. I should stand out here like everybody else. And I don't think anybody was recognizing you either. But I appreciate that. You remember that?
Well, I don't remember that exact instance, but that is what I did. That is what I did the whole time that I was governor. And I think it's what elected officials ought to be doing. Elected officials aren't any different than anyone else.
Well, I appreciate it. I appreciate you having let me interview
Absolutely.
you way back when, before you were even governor. I don't know if you remember that.
Yeah, I do. Many interviews along the way.
Okay. Well, thanks very much. I hope
All right.
this has been worth your while. We'll
Good.
get it up on YouTube or wherever
Good, thanks.
and let you know, of
All
course.
right. All right.
Okay, thank you so much.
All right.
It was great to see you.